BCS based biowaivers are granted for the immediate release formulations containing the drug substance belonging to the highly soluble BCS class 1 or 3. The permeability may be high for the BCS class 1 or it may be low for BCS class 3, but depending on to the solubility and permeability, immediate release formulations which release the drug substance or which dissolves the drug substance within 15 minutes or 30 minutes can get the biowaiver. So the main requirement for the biowaiver is drug with high solubility, immediate release formulation with dissolution, rapid or very rapid, compositional similarity in reference to the RLD or comparator formulation or reference product, and there should not be a toxicity of the API like narrow therapeutic index API. So based on these requirements, whenever the manufacturers apply for BCS based biowaivers, there are certain challenges. The challenges may be related to the drug substance, may be related to the formulation, dissolution, and others. Drug specific challenges are related to solubility and permeability. Solubility issues like pH dependent solubility, which may affect the dissolution. Permeability issues like variability in the permeability assessment. Stability concerns of the API. API may get degraded into the GI tract, so it can impact the absorption. Then some formulation challenges are there. Excipients may have effect onto the permeability, solubility, or it may require justification. Excipient should be similar as like the innovator or reference listed drug. Polymorphic variability of the API may impact dissolution. Manufacturing variability may impact dissolution. There may be batch to batch variability. So maintaining the batch to batch consistency for dissolution is a challenge. Regulatory challenges are there. There are some differences in the BCS based bio requirements by various authorities, regulatory agencies. So varying the criteria for biowaivers by USFDA, EMA, WHO, and some other countries is a challenge. The dissolution is required to be rapid, very rapid, or it should match the innovator. There are some data gaps and justifications. Missing human mass balance data may require additional permeability studies. Analytical and methodological challenges are there, like dissolution testing limitations are there. Then dissolution versus prediction of the in vivo performance may be challenging. Reproducibility of permeability studies may be difficult, and impact of pH variability. These are some of the analytical and methodological challenges. Clinical and pharmacological challenges, pharmacokinetic challenges are there, like food effects and interindividual variability. Excipient effects on the drug absorption. If the drug is belonging to BCS class 3, so permeability may be affected by some excipients. And for BCS based biowaiver for BCS class 3 drugs formulations are required to meet the Q1 Q2 criteria, that is very difficult to achieve. Permeability may be changed by some of the excipients like sorbitol, mannitol, which may impact the gut transit. Regulatory restrictions are there, some guidelines are there which can be challenging to meet the requirements of. Then in vitro testing and modeling challenges are there. There is need for biorelevant test. There should be model tools to predict the bioequivalence with certain excipient variation ranges. Then there is a limited data availability for the in vitro testing and modeling compared to the BCS based biowaivers. There are chances that the B study may fail, but the bioweaver criteria may pass, or the bioweaver criteria may pass, but the in vivo study may fail. But generally, this doesn't happen as the requirements for the BCS based bioweaver are much stringent. Specific concerns and considerations are there, like for BCS class 2 drugs. Low solubility drug raises the concern due to dissolution variability. Narrow therapeutic index drugs cannot be under the BCS based biowaivers as there is a risk of safety and efficacy. Pediatric formulations are there. Solubility differences in children versus adults can impact the waiver eligibility. There is a concern about the fixed dose combinations with soluble insoluble APIs or the combination of BCS 1 and 3 drug substances. These are some of the challenges. Another challenge is cost challenge and time challenge. Whether to go for the BCS based bioweaver or whether to go for the bioequivalence study is the challenge for taking the decision. I will be making another video on this. So I hope this information is for the understanding of challenges in the BCS based biowaivers. You can go through the playlist of this Pharma Learning in Depth channel. You can get various videos. I request you to go through those videos to have the clarity on these topics. These topics are the most favorite topics for the interviewers nowadays, as the biowaivers BCS classification is asked in the examinations, in the interviews also. Thank you for watching the video, and let's meet soon with such kind of informative video.